welcome to this coffee chat with me. I'm Tiffany Rubin, a registered nurse at Silver Lining Home Healthcare, and the whole point of these videos is to make your life easier for you. So I hope you find this video on doing home care yourself beneficial. If you are at all like my mother, you do not want to pay for home care. And I could spend all day telling you how it improves health outcomes and it promotes independence and it increases quality of life. But you've probably heard it all before. And you might want to do home care on your own because of financial reasons to make it more cost effective. Or you might want to do it because you've had a bad experience with an agency. And Silver Lining would love the opportunity to change your mind when you're ready. But in the meantime, I wanted to give you the resources you need to do home care yourself. So I'm going to go through three main things when you're looking to do home care yourself, and then I'm going to finish out the video with the questions to consider, how you're going to actually save money through this, and actual questions that you need to have answered before you embark on this journey, just to make it the best experience that it can be, decrease your liability, some real tangible things. So the first thing when it comes to doing home care on your own or for you yourself or a loved one is to look into what insurance already covers for you. So you're going to want to look into what your major medical policy covers for home care. You're going to want to look into any supplemental insurance that you have. A lot of Medicare Advantage plans are now providing supplemental coverage through their plans for in-home care. So you're going to want to look into that. Medicaid waiver programs, different than Medicaid, different. Most states have Medicaid waiver programs for home-based, community-based care. You're going to want to look into that for your state and what the qualifications are. And then there's a lot of disease-specific grants and information out there. So reach out to your local area on aging. They have a ton of resources. And if you ever can't find the resources you need, shoot us an email, Jackie@silverlininghealthcare.com, and we'll work to get you the resources that you're looking for and that you need. So step one, know what coverage already exists for yourself. Step number two, get paid for the care that you're providing. If you're a loved one and you're providing care for someone else, there are ways through different programs that you can potentially get paid. There is a qualification process for this, and there is usually a training process for you. And I can speak from experience because my mom and I and my sister are actually care providers for one of my sisters who is differently able and lives in Pennsylvania. So we've gone through this whole process before, and it can take time. So give yourself some grace and patience, and the agency some grace and patience. They have specific guidelines and regulations they have to abide by. So there is actually going to be a link in the description of this video, and there is a website called Paying for Senior Care, and they just build out all the different terminology you're going to want to know as you go through this process of getting paid for care for your loved one. And so if you just take those terms and you actually Google those terms for your state, so this program in Pennsylvania, it will help you find the resources that you need to get paid for care, find the right programs in your area to get paid for care. And again, you can't find the resources you need, reach out to us at Jackie@silverlininghealthcare.com, and we will work to find the right thing. Number three is to actually hire your own caregivers. So you've already looked at what coverage you have. Now you've looked into getting paid for care yourself, and you either don't want to do that or you want to do that and supplement with additional care. You can hire your own caregivers. When you do this, you have to be researched. You have to know what you're getting into. So I'm going to spend a little bit of time on this particular section, the questions that need to be answered, what you should know going in, why this is going to save you money. And I want to make sure that I don't miss anything. So you might see me glancing over here at my notes because this is super, super important. The other thing, if you're going to be looking into doing care yourself, is to look into a website like CareLinks. And that link is in the description of our video here. But they are a company that actually helps you handle the liability, the tax side of employing your own people as well, and are great resources. So look into someone like them. So list of things to have in place. Of course, these are not all inclusive. This is just to get you started. You're going to want to have professionals, an elder law attorney, an accountant, making sure that you're on the right track. But a list of things to have in place: workers' compensation policy, general liability insurance. You're going to want to have a secure way to track and pay your caregivers' hours, and you're going to want to have a really effective way to communicate with your caregivers. Updates on care, changes to the care plan for your loved one. And this becomes especially important, we've found, when when the mental status of your loved one changes. So it might be really, really easy right at the beginning and there's no issues in the picture, but then mom or dad develops dementia and their mental status changes, their coherency starts to change. They can't communicate with the caregivers regularly on what their needs are. They don't remember what their routine is. So having a really effective way to communicate with your caregivers is going to be really key. So that's those 4 things to make sure that you have in place. Why will you save money by doing it yourself? A couple of reasons. 1, you won't pay the employer taxes. Your employees will be 1099s, contractors. So that's something to be aware of. Number 2, you won't have to abide by any of the regulation that a healthcare agency will have to. So we have to abide by electronic visit verification, HIPAA regulations. We have to have training and development. And most agencies in most states have a very long list of regulations that they have to comply by. And so you don't have to deal with any of those. So that's going to greatly reduce the cost. And that's why sometimes it can be more cost effective and a better situation for you to hire caregivers if you're in a position to do so and manage them properly and get all the policies in place to protect yourself. So things to be aware of. 1, the best way to hire a caregiver. What certifications do they need? How are you going to find them? 2, the best way to fire a caregiver or terminate them. It might not always be a bad situation, but it might be one of those things where your mom's needs change and now you need a different level of caregiver, or the caregiver can no longer meet the schedule that you really need. And while you love them and they're a part of your family, if they can't fill the hours that your mom needs, then it's no longer a good fit. So you need to make sure that you know how you're going to go about terminating a caregiver if it doesn't work out or if it's no longer the right fit. 3, you're going to need to know how many caregivers you need. And so when you do this calculation, you're typically going to want to base it off of a 40-hour work week. If you need 24/7 care for mom, that's 168 hours in a week. That is at least 5 caregivers if nobody goes into overtime. Plus, you're going to want to make sure you have a little bit of extra people on your bench for when someone calls out, people go on vacation, children are sick. For the weekends, nobody wants to work every weekend. So make sure you give yourself an accurate depiction of how many caregivers you're going to need. 4, you're going to want to talk to an accountant. You need to know the tax implications of everything, how to best file things, how to best pay caregivers, and limit your liability there. So then the last section here we're going to go over is questions that you need to have answered. So that first one we kind of touched on here is, how will I find caregivers? What platforms am I going to use to find them? How am I going to make sure that they're good? How am I going to background check them and make sure that they have the right certifications? Number 2, what will I do if a caregiver calls out? This is a crucial question. What will happen if 5 minutes before my caregiver is supposed to be there, they call me and they say they can't show up to their visit that day for XYZ reason? What is my backup plan? Is that an adequate backup plan for the care that mom and dad need? And just make sure that you think all of that through. 3, questions you need to answer. How much money are you actually paying? You really need to do a full budget forecast. How much are you paying to your caregivers? How much for your policies, your liability, your workers' comp, any travel that you're going to be giving to your caregivers, any additional benefits you're going to be providing to them? Make sure that you have all of this listed out for a couple of reasons. 1, you need to know how to budget for right now. But 2, it'll be a huge resource later on when you need to make the decision on, okay, well, how much are we already spending and how much would it be to bring an agency in? How much would it be to have mom go into assisted living if that's what she wants and what's the best thing for her? So it'll help you understand the difference in change that will need to happen from having your own caregivers to moving to a different level of service. And the 4th question, how will I manage these funds, mom's funds, dad's funds, my funds, to make sure I don't run out of money? Running out of money, typically, so with retirement, it's been so interesting for us to see. For retirement, for a lot of people, long-term support services don't always factor into their retirement plan. They factor in cost of living, housing, food, but not long-term support services. So if you want to stay in your home, if you want to make sure that you don't run out of money, or you want to limit how much you run out, or you want to leverage the resources that are out there, talk to an elder law attorney. I cannot emphasize this enough. If you are older and you haven't spoken to an elder law attorney, I highly suggest you do it. It is worth the investment when you have the right elder law attorney giving you the right advice. It is not an estate planning attorney. They are different. While some overlap, they are different. So if you want more resources, pop over to our website, silverlininghealthcare.com. Go to our resources section, and there's a flyer on elder law with a few of our preferred providers for that, at least in the state of Delaware. And a lot of people are doing virtual visits now, so you never know if it's the right fit for you. So I hope this was really helpful for you today, and I hope that you feel empowered to do home care on your own. There are some incredible resources out there to empower you as the primary caregiver, so know that you are not alone. And if you've decided after this video or in the future, I want to go with an agency, again, head over to our resources section of our website, silverlininghealthcare.com, and we have a glance chart that will help you compare different levels of agency so you can know what's the right fit for you. Thanks for joining me today, and reach out anytime you guys have questions, Jackie at silverlininghealthcare.com.